Community-based healthcare is a collaborative, evidence-based model designed to meet the healthcare needs of the community. New stimulus for community-based nursing practice. Changes in healthcare financing move patients more quickly to the community setting. Because patients spend less time in acute care settings, there is a growing need to have organized healthcare services where the population lives, works, and learns. As community healthcare partnerships develop, nurses are in a strategic position to play an important role in healthcare delivery and to improve the health of the community. Focus of community-based nursing. Patients are moving from acute health care in hospital-based settings to community-based settings that focus on health promotion, disease prevention, and restorative care. A healthy community includes elements that maintain a high quality of life and productivity, such as safety and access to healthcare services. Focus on health promotion and disease prevention is essential for the holistic practice of professional nursing. Community-based healthcare focuses on a model of care to reach all in a community. Priority is helping individuals and communities to create a healthy living environment, occurs outside of traditional healthcare facilities, provides services for acute and chronic conditions. Community-based healthcare focuses on primary rather than institutional or acute care. It is also geared at providing knowledge about health and health promotion and models of care to the community. Public health problems are influenced by political policy and the Affordable Care Act, social determinants of health, increases in health disparities, and economics. More than ever before, the healthcare system must commit to reform and bring attention and healthcare services to all communities. Achieving healthy populations and communities. The Department of Health and Human Services protects the health of all Americans and provides essential human services. U.S. Department of Health and Human Services designed the Healthy People Initiative. The 2020 document strives to ensure that Healthy People 2020 is relevant to diverse public health needs and seizes opportunities to achieve its goals. Goals are to increase life expectancy and quality of life, and to eliminate health disparities through improved delivery of healthcare services. Improved delivery of health care occurs through 1. Assessment of healthcare needs of individuals, families, and communities. 2. Development and implementation of public health policies. And 3. Improved access to care. Health professionals provide leadership in developing public policies to support the health of the population. Strong policies are driven by community assessment. For example, assessing the level of lead poisoning in young children often leads to a lead cleanup program to reduce the incidence of lead poisoning. Identifying evidence-based practices to help more people manage chronic illnesses in the home and the community addresses the needs of nurses and their patients. Improved access to care ensures that essential community-wide health services are available and accessible for the total community. Public health services aim at achieving a healthy environment for all individuals. Healthcare providers apply these principles to individuals, families, and the communities in which they live. Nursing plays a role in all levels of the health services pyramid. By using public health principles, you are better able to understand the types of environments in which patients live and the types of interventions necessary to help keep them healthy. Please review Box 3.1, Evidence-Based Practice, Promoting Informed Decision-Making in a Community Setting, as a supplement to this PowerPoint. The 5-level health services pyramid is an example of how to provide community-based services within existing healthcare services. Case study: Kim Callahan is a student in a community health nursing course. She is working in a community nursing service within a large city. Most of the patients in this agency are Bosnian immigrants. A major care initiative in this agency is to provide child examinations and immunizations to get children ready to enter the public school system. The question is, what are some challenges that Kim may face when providing care to this population? Language barriers can be an obstacle for immigrants accessing healthcare. Also, lack of knowledge concerning health promotion and the disease process can be barriers to accessing care for this population. Social determinants of health. Social determinants of health are factors that contribute to a person's current state of health. These factors may be biological, socioeconomic, psychosocial, behavioral, or social in nature. Scientists generally recognize 5 determinants of health. 1. Biology and genetics such as sex and age. 2. Individual behavior such as alcohol, injection drug use, unprotected sex, and smoking. 3. Social environment such as discrimination, income, and gender. 4. Physical environment meaning where a person lives or crowding conditions. And 5. Health services such as access to quality health care and having health insurance. Whether these factors affect a single family or the community, they impact the overall health and wellness of that community. Health disparities negatively affect groups of people who have systematically experienced social or economic obstacles to health. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. Health disparities are inequitable and are directly related to the historical and current unequal distribution of social, political, economic, and environmental resources. Community health nursing and public health nursing are used interchangeably, and while they are different, they also have similarities. Public health nursing requires an understanding of the needs of a population or a collection of individuals who have common characteristics. A public health nurse understands factors that influence health promotion and health maintenance, the trends and patterns influencing the incidence of disease within populations, environmental factors contributing to health and illness, and the political processes used to affect public policy. Public health nursing requires preparation at the basic entry level and sometimes requires a baccalaureate degree in nursing that includes educational preparation and clinical practice in public health nursing. A specialist in public health has a graduate-level education with a focus in the public health sciences. The emphasis in community health nursing is to improve the quality of health and life within that community. In addition, the community health nurse provides direct care services to subpopulations within a community. These subpopulations often have a clinical focus in which the nurse has expertise. By focusing on subpopulations, a community health nurse cares for the community as a whole and considers an individual or family as only one member of a group at risk. Competence as a community health nurse requires the ability to use interventions that include the broad social and political context of the community. The educational requirements for entry-level nurses practicing in community health nursing roles are not as clear as those for public health nurses. Not all hiring agencies require an advanced degree. However, nurses with a graduate degree in nursing who practice in community settings are considered community health nurse specialists, regardless of their public health. Nursing practice in community health. By knowing the community's members, the community health nurse is able to understand the needs of the population and can respond to changes in the community. In the healthcare delivery system, Nurses who become experts in community health practice usually have advanced nursing degrees, yet the baccalaureate-prepared nurse generalist is also able to formulate and apply population-focused assessments and interventions. The community health nurse knows the community members, along with their needs and resources, and then works in collaboration with community leaders to establish effective health promotion and disease prevention programs. This requires working with highly resistant systems, such as the welfare system, and trying to encourage these systems to be more responsive to the needs of a population. The skills of patient advocacy, communicating people's concerns, and designing new systems in cooperation with existing systems help to make community nursing practice effective. Community-based nursing involves both acute and chronic care. It enhances an individual's capacity for self-care, promotes autonomy, uses critical thinking, reduces costs, and provides direct access to nurses. Community-based nursing takes place in the home or clinic, where the focus is on the needs of the individual or family. When caring for these patients, you will apply knowledge learned in upcoming chapters on family theory, principles of communication, group dynamics, and cultural diversity. Nurses partner with their patients and families to enable them to ultimately assume responsibility for their healthcare decisions. Vulnerable populations. Community-based nursing centers often care for the most vulnerable of the population. Vulnerable populations are groups of patients who are more likely to develop health problems as a result of excess health risks, who are limited in access to healthcare services, or who depend on others for care. These groups include individuals living in poverty, older adults, people who are homeless, immigrant populations, individuals in abusive relationships, substance abusers, and people with severe mental illnesses. Public and community health nursing and primary care providers share healthcare responsibility for health promotion, screening, and early detection and disease prevention for vulnerable populations. Patients who are vulnerable often come from varied cultures, have different beliefs and values, face language and literacy barriers, and have few sources of social support. To provide competent care for vulnerable populations, you need to assess these patients accurately. Complete assessment of vulnerable populations enables a community health nurse to design interventions within the context of a community. Please review Box 3.2, Guidelines for Assessing Members of Vulnerable Population Groups, and Table 3.1, Major Health Problems in Older Adults and Community Health Nursing, as a supplement to this PowerPoint. Case study continued. Kim and her classmates conducted an assessment of the community's healthcare needs and practices. This is a close community that is facing many challenges, although chronic disease is absent in this population. General preventive healthcare practices, including well examinations and basic screenings, are lacking. The question is, how can Kim convince this population of the value of well care? Nurses, such as Kim, are in an ideal position to facilitate the interconnections between patient culture, language, and health literacy in order to improve health outcomes for culturally diverse patients. A nurse in community-based practice needs a variety of skills and talents to be successful. As a caregiver, a nurse uses a critical thinking approach to apply the nursing process and ensure appropriate, individualized nursing care for specific patients and their families. As a case manager, a nurse establishes an appropriate plan of care based on assessment and coordinates needed resources and services for a patient's well-being across a continuum of care. As a change agent, a nurse identifies and implements new and more effective approaches to problems. As a patient advocate, A nurse provides the information necessary for patients to make informed decisions in choosing and using services appropriately. As a collaborator, a nurse works not only with patients and their families but also with other related healthcare disciplines. As a counselor, a nurse helps patients identify and clarify health problems and choose appropriate courses of action to solve those problems. As an educator, a nurse has the opportunity to work with single individuals and groups of patients. Prenatal classes, infant care, child safety, and cancer screening are just some of the health education programs provided by nurses in the community practice setting. As an epidemiologist, a nurse is involved in case finding, health teaching, and tracking incident rates of an illness. Nurse epidemiologists protect the level of health of the community, develop sensitivity to changes in the health status of the community, and help identify the cause of these changes. Time for a quick quiz. Vulnerable populations of patients are those who are more likely to develop health problems as a result of A. Living at home, B. Abusive habits, C. Citizenship, or D. Middle age. The answer is B. Abusive habits. Case study continued. Many members of the Bosnian community are suspicious of free or low-cost care. Kim attends community meetings with her community nurse preceptor to assess the beliefs and concerns of the community. Misunderstandings and fears about health care services in this country are identified. Kim uses beneficence, wanting to do what's best for the most people. Kim respects the community's beliefs. Question: how would you respond to a community that feared the health care you were offering? The nurse should show compassionate, be culturally sensitive, non-judgmental, and unbiased to assist in developing relationships with the community. Community assessment is the systematic data collection on the population, monitoring the health status of the population, and making information available about the health of the community. Components of the community include structure or locale, people, and social systems. To develop a complete community assessment, take a careful look at each of the three components of the community to identify needs for health policy, health programs, and needed health services. Once you have a good understanding of the community, perform all individual patient assessments against that background. Please review Box 3.3, Community Assessment, as a supplement to this PowerPoint. Case study continued. One single-parent family in the community is 30-year-old Katrina Dudek, and her two children. Her children are ages 3 years and 6 months. Kim and the community health nurse work with Ms. Dudek to determine the health care needs of her children and herself. So far, Ms. Dudek and her children have not received any care. Kim and Ms. Dudek discuss the need for immunizations of the children and set that as a goal. Ms. Dudek is fearful about providing an immunization history about her children. What should be Kim's actions? The challenge is to promote and protect a patient's health within the context of the community. It is important to understand patients' lives by establishing strong, caring relationships with patients and their families. The day-to-day activities of family life are the variables that influence how you will adapt nursing interventions. The time of day a patient goes to work, the availability of the spouse and patient's parents to provide child care, and the family values that shape views about health are just a few examples of the many factors you will consider in community-based practice. Once you acquire a picture of a patient's life, you then design interventions to promote health and prevent disease within the community-based practice setting. Time for a quick quiz. In identifying needs for health policy and health program development and services, a community assessment focuses on which of the following elements? A. Structure. B. People. C. Social systems. D. Environments. Or E. All of the above. The answer is E. All of the above. Case study continued. Kim identifies community leaders to serve as key persons in educational programs. Kim spends 12 weeks working with the community agency and leaders to explain how the clinic provides services and the confidentiality of these services. Kim presented information in 3 homes as well. A gradual increase was noted in the use of services, including fewer missed appointments. As a result, Kim learned the importance of including the community and community leaders in all aspects of program building.